Okay, so let's talk about something that's super important, but honestly, a little misunderstood sometimes. Bacterial STIs. Over the next few minutes, we're going to break down exactly what they are, who's most at risk, and this is the most important part, the simple things you can do to be in total control of your health. All right, I want to start with a direct question for you. You've probably heard these names before, right? Chlamydia, gonorrhea, and syphilis. But what's the one single thing that connects all three of them? And here's the answer. This is probably the biggest takeaway of this entire explainer. Yes, these infections are serious, but, and this is a huge but, they are also treatable and, in many cases, completely curable. And that's really what this is all about, shifting from a place of worry to a place of empowerment, just by being informed. Okay, first things first. Before we can talk about how to deal with these infections, we need to know what we're actually up against. So what does it even mean when we say an STI is bacterial? It's actually pretty simple. They're caused by bacteria, and that distinction is absolutely crucial. See, unlike some viral infections that can stick around for life, bacteria are something we can fight directly. We have antibiotics that can target and, completely wipe them out. And that is some seriously good news. So for our purposes here, we're really going to zero in on the big three, chlamydia, gonorrhea, and syphilis. And why these three? Well, because they're the most common, and the data behind them tells a really, really important story, especially for young people. So who is actually being affected by these infections the most? Well, when you start digging into the numbers, a really clear and kind of surprising picture starts to form. Just take a look at this number, 48%. I mean, that's a huge figure, right? It's nearly half of something, but half of what? That 48%, that's the share of all new bacterial STIs that are diagnosed in people between the ages of 15 and 24. Just let that sink in for a minute. A single 10-year age bracket makes up almost as many cases as everybody else combined. That's not just a statistic, it's a wake-up call. And it gets even more dramatic when we look at just chlamydia. A wild 62% of all cases, that's almost 2/3, are found in that same 15 to 24 age group. This isn't just a number game. It's a clear signal that this group needs the best information we can give them. So, if these infections are so incredibly common in young people, why don't more people realize they have them? Well, that question leads us to one of the biggest challenges of all. You'd think there would be obvious warning signs, right? But here's the tricky and kind of scary truth about both chlamydia and gonorrhea. Yeah, some people get symptoms, but the key fact, right there in that last column, is that they very often cause no symptoms at all. You could have an active infection and feel totally, completely fine. Now, syphilis is a little different. It tends to move in stages. It might start with just a single sore that's actually painless, so it's really easy to overlook. If you don't treat it, it can move into a second stage with things like a rash or fever. But the real danger is that late stage, where if it's still untreated, it can cause some serious long-term damage to your organs, like your brain and heart. And all of this leads us to one simple, unavoidable truth. You just can't rely on symptoms. So what can you rely on? Testing. That's it. It's the only way to know for sure what's going on, and it is by far the most powerful tool you have. Which actually leads us perfectly to the good news. Okay, so what if a test comes back positive? What happens then? Well, luckily, the path to getting better is incredibly clear and effective. The treatments for these are fantastic. For chlamydia, it's typically just a short round of antibiotic pills. Super straightforward. For gonorrhea, it's also antibiotics, though sometimes an injection is part of the plan because some strains are getting a bit stubborn. And for syphilis, penicillin injections are the gold standard, and they work incredibly well, especially when you catch it early. In every single case, we have the medical science to fix it. And that is why catching these things early is the absolute key. It makes the treatment simpler, it stops any long-term health issues before they can start, and, really importantly, it protects your partners by breaking the chain of transmission. Of course, treatment is just one side of the coin. An even more powerful tool, prevention. So, how do you lower your risk of even getting an infection in the first place? Well, you've basically got two main strategies. First, there are barrier methods, things like condoms and dental dams. If you use them the right way, every time, they create a physical shield that just massively cuts down your risk. Then, on the other hand, there's abstinence, which just means not having sex, and that's the only 100% ironclad guarantee to avoid an STI. Now, for anyone who is sexually active or plans to be, the absolute smartest approach is to combine things, using barrier methods consistently and then making regular STI testing just a normal part of your health routine. That combination gives you a really powerful defense for both you and your partners. So let's bring this all together. We've talked about what these infections are, what the risks are, and what the solutions are. But what's the big idea here? It really all comes down to one thing. You are in the driver's seat. So, just to recap the most important stuff. We know young people are at a higher risk. We know you can't just wait for symptoms because they might never show up. But we also know that these bacterial STIs are absolutely treatable, and you have real effective ways to prevent them. At the end of the day, your health is exactly that, yours. It's in your hands. And walking into a clinic or asking a doctor for a test isn't something to be afraid of. It's actually one of the strongest, smartest things you can possibly do for yourself. And that really is the only question left. We've laid it all out. We know that knowledge is power, and now you have that knowledge. So are you ready to take charge? Thanks for joining me.